Close your eyes. Imagine you are one of the 29.1 million people who have diabetes. And to add to that, you are also one of the 70 million who have high blood pressure. But things are fine. You have medication to control it, a good doctor in the area to monitor your health, and health insurance to help with the cost. Now imagine you wake up tomorrow only to find out you no longer have a job, no longer have health insurance. You have to move to a more impoverished area and get a part-time job with low minimum wage. Your biggest concern now is how you will be able to control your blood pressure and diabetes if you have no way of paying for the services. The closest doctor is in an emergency clinic miles away. You have no car to get there, no money to pay for the services, and the clinic is backed up with patients. You can't afford on your minimum wage job to take that time off to wait in a line for hours. Open your eyes. Luckily, that was all a scenario. But for 5.3% of our population, that is the case because they do not have access to medical services. Hi, I'm Susan Purcell, and I'd like to take a moment to discuss poor access to health services, the implications on our population, how it affects the common taxpayer, and how we can create a change. Access to health services is a serious public health problem within our society. Partially this is because it's a problem which amplifies itself. What I mean here is people who do not have access to medical services to monitor, control, or prevent disease are more likely to develop worse health conditions and often more disease. Why would this be a concern to you, you may think? Well, beyond it being a part of humanity to want to help people, it costs you money as a taxpayer. The average emergency room visit, which could have been prevented by primary care or seeing a routine doctor, can cost up to $9,000. Now multiply that by 5.3% of the population. Kaiser Family Foundation data said about 3.8 million of Florida's 19 million residents were uninsured in 2013. It was estimated that each resident pays an extra $2,000 per hospital stay to cover the uninsured people's costs. That's $2,000 out of your budget if you have health insurance. Now, if these people had access to medical services, we could reduce hospital costs by $2,000 because people would be receiving primary care they need, and it would keep them out of the hospital. The main goal with these health services is to keep them out of hospital care. Screenings, prescriptions, immunizations, long-term cares, and reproductive health can keep people out of the hospital and prevent the onset of disease that they may be genetically predisposed to. This chart is an excellent example of how access to health services can reduce health complications. Primary, secondary, and tertiary prevention is necessary in not only preventing the onset of disease, but controlling it. If we use diabetes as an example, we can talk about how the education of risk factors for diabetes is a primary prevention technique. When you educate a patient on how their nutrition, genetic predisposed factors, and exercise levels can impact their risk for having diabetes, you can therefore prevent them from it occurring. If, however, they still do have the onset of diabetes, they will have caught it just in time before any complications like blindness or loss of a limb can complicate things further. By having routine, regular doctor's visits, you can monitor blood levels, insulin levels, and be able to diagnose the patient as soon as the onset of diabetes occurs. Secondary prevention includes that diagnosis and giving people the cure that they may need. In this case, it would be insulin shots. From there, tertiary prevention would be just to monitor the disease so that no further complications occur and to keep them out of the hospital and alive and healthy. So by continuing insulin shots for a person with diabetes and continuously seeing their doctor for routine visits, blood work, and other run-ups, they can control other complications which could worsen their health. So why is there poor access to health services? Oftentimes, it's just simply because somebody cannot afford health coverage. They don't have health insurance, Medicaid doesn't provide them with the coverage they need, doctors are simply not in the area where they can travel to, and they have a poor understanding of how specific behaviors have serious implications on their health. There are many debates on how to fix the issue, from expanding Medicare to more taxes, a higher minimum wage, or required health care for employees that work over 30 hours. But the best decision would be for economists to analyze each healthcare reform proposal to see which would be most beneficial, and we should stick to it until a new one comes that is more beneficial for us as taxpayers. One thing is for sure, we can't afford not to provide health services to people. By providing health services, we can improve our nation's health, reducing cancer, teen pregnancy, diabetes, obesity, and saving us millions in the long run. For the people that think, I worked hard to get where I am, and I have health care, so they can too, you need to realize that it's a true crisis that affects us all, as we saw in the case of Florida. For each service that we provide, we can save millions in the long run by limiting the amount of emergency care visits. Thank you for watching my presentation.